session on equity and in global training and capacity building. My name is Tressa Craven. I'm from Welcome Connecting Science, based near Cambridge in the UK. I'm standing in for Alice Matimba, who is the advertised on the bill. We've got several speakers here today from across Asia and the Philippines and India, who are also going to talk about their experience in training and capacity building. First, I'm going to start off with a brief introduction to Welcome Connecting Science and our global training program and our strategies for training and capacity building. Okay, sorry. So we're based near Cambridge in the UK, and we're called Welcome Connecting Science. Among the strategies and aims we have is one is to develop a global capacity and training, and our main way of doing this is working in partnership and collaboration with particular people based in the global south, in Africa, Latin America, and Asia, who are experts in genomics in their fields, and we work with them to train underserved audiences in LIMICs. The aim is really to contribute to the development of genomic medicine through the provision of education and training to clinicians and healthcare professionals, including those on the front line of genomics, and that would include GPs, primary care physicians, nurses, genetic counselors. And the ultimate aim really is to impact policy, practice, and careers. We are very lucky in that we have a dedicated team of scientists, content developers, IT lab specialists, and education experts and event organizers based at the Jinan campus to help us do this. And I've just mentioned impact there. From recent surveys, we can see that 93% of those who've taken our global training program report that the course contributed to their career progression. So that makes us very pleased about that. To give you a little overview of the genomics and global training program and also the online MOOCs that we have. As I mentioned before, collaboration is really important. We have a global training program that runs about 10 courses per year. The ethos there is to have regionally tailored training, and we do a needs assessment for each course to make sure it's really targeted at a particular audience. We also collaborate with teams in the region. Before the pandemic, these were all face-to-face courses. So essentially they would target about 30, 40 people in the region. And we would work with hosts to collaborate with them to develop the training in parallel. Alongside that, we've done 5 online courses that are free and available to everyone to join online. We use the FutureLearn platform. We've been running a program about bacterial genomics since 2018. These courses have been run several times now, and we've reached over 100,000 learners globally. You can see there on the right-hand side a table of just a quick run through of the types of courses we have run along pathogen genomics. You can see there's a mixture of formats from informatics, lab-based courses, blended learning. We also have a few discussion-based courses as well, and they run the whole gamut from pathogen genomics to cancer, to protozoans, to clinical microbiology, which was really focused on healthcare researchers in those regions as well. So a real suite of training available. Alongside that, we run a series of conferences, generally about 18 to 20 conferences a year. Over the pandemic, we've had to completely switch to virtual, and during the last 2 years, we ran 43 events reaching 10,000 people globally. We have seen a real uptick in the number of people who've come to our meetings online who couldn't obviously reach them in person when they were happening on the campus pre-2020. We've pioneered a hybrid format of conferences since June 2022. So where people can join in person or online, and that's our plan going forward. We've got 5 genomics and global health conferences in our program, ranging from public health microbiology with a large flavor of bioinformatics. We've got conferences on antimicrobial resistance, virus genomics and evolution, and a large conference on malaria and also the microbiome. In the last year, we have trialed some new options for researchers based in Africa, Asia, and Latin America to ensure that they have free online registration to attend our conferences. We found when everything was virtual, everyone was the same, they could join online, but obviously if we're going to be hybrid, there is that disparity that might creep in. So to try and mitigate for that, we've introduced free registration. This is just quite a busy slide here. I'm just going to talk about this very briefly. But over the last few years, we've pioneered several new delivery methods and several new initiatives. Obviously, we had to switch completely to virtual during the pandemic. So here you can see our scheme for our courses, where people join online. We had liberal use of Zoom and Slack. We've used virtual machines, but lots of breakout rooms so people can have that kind of close contact with the trainers. We've pioneered how to scale up face-to-face teaching by using a really innovative method called distributed regional classrooms. This was pioneered by H3A Bionet in Africa. And essentially, these are a series of parallel digital classrooms where everyone is going through the same material at the same time. And you can scale up from, say, 20, 30 people on one course online to over 400 participants learning the same material over a course of 6 to 8 weeks. Alongside that, we've got some new train the trainer initiatives. And these are pioneered over the last 3 or 4 years. We've got several different formats, from short bite-sized train the trainer modules that are at the beginning of each of our courses. We've had collaborative courses that we've developed with other specialties. And we've got some dedicated face-to-face and online, and also MOOCs focusing on train the trainer in genomics and informatics. And we've also recently started a really exciting course on train the trainer for genomic educators to help with secondary school and teachers focusing on genomics. And that's had a really interesting uptake. So the main reason for training in this way is to try and increase capacity with people who can train others and hopefully have that cascade effect. And we are aiming to really promote South-South collaborations with these initiatives. Alongside this, we have started a new podcast series focusing on mentoring, Your Digital Mentor. You can see it there on the bottom right-hand side. And this really underpins everything we do in terms of encouraging mentoring, the skills that are around the research, talking about how you publish, grant writing, all the very sort of, we would call soft skills that are often kind of missing, but really important. As I mentioned earlier, we've pioneered several new